Yeah, Dr. Gulani, a lot of people contact me about the surgery. It's 21 years since you did my surgery. And I have people calling me through Messenger and Facebook to say, hey man, you don't know me, but do you know this guy? And I have to explain it. So I think it's important to educate people about this surgery with the human tissue that you did on my eyes 21 years ago.
Always a pleasure, and great to see you here.
And this lady called from the Caribbean to ask me. I didn't know her a couple Sundays ago. So I think it's important that we share and educate people as to what it's about, because a lot of people in the Caribbean suffer with this issue.
Surely. And again, guys, to everybody out there who have questions about how to fix your red eyes, pterygium, and pinguecula, it's a pleasure. As usual, my patients, my darling patients, all of them from all over the planet. You were in New York at that time?
Yes.
And did your surgery 21 years ago. You had that aggressive red pterygium all over your eye. And we did it with no-stitch human placenta surgery. And how's it doing?
It's wonderful because it was a double root.
I remember.
And you did not expect that until we got into surgery.
Yes.
And I remember the Kamra saying, well, we have some places to be. And he says, no, we have to do the full thing.
I love it. Yes, that's the attitude I still carry. We have to do it right. And her eyes are still sparkling white. So 21 years later, after the pterygium surgery I did with my no-stitch tissue. So the commitment to teach, actually, my patient, my amazing patient Ingrid, is immortalized in this book I wrote for eye surgeons. This book, published by theme publishers out of Germany and New York, carries all my experience over 3 decades and other surgeons too of how to work on pterygium and pinguecula cases and help them see. And I also want their eyes to look sparkling white. Understand, please, this should not be a guarantee to you, but guarantee of a surgeon to himself or herself that I must execute that brilliance. And if you remember, Ingrid, that time, over 2 decades ago, I had started the concept of when I do these surgeries to improve their red eyes, I would make them walk to the mirror next day after surgery to hold myself accountable. And remember how you saw your eye?
Yes, I remember. And what I didn't tell you is the other 2 surgeons who I visited before I met you, before you called me 7:30 on a Saturday night.
Yes.
I never forgot it. I'm like, who is this guy calling me at 7? What doctor is calling me at 7:30?
I make my plans on the weekends, so that's why. But yes, go ahead.
The other doctors told me I would lose my vision for 3 months. And I was, oh my gosh, I was so afraid. But here this guy I don't know. Good evening, I'm Dr. Gulani, and I saw your case. I would like to use you. Do I have your permission?
Yes.
And I said, on a Saturday night at 7:30, yes.
Yes. So it's always a pleasure, guys. I was heading the department of University of Florida at that time for cornea disease and external eye surgeries and for Lasik. And I had made a plan, and among the first in the country, I even used 3D technology at that time to perform the surgery, and it took her permission because I always record all my patients to help other surgeons understand. So yes, coming back to her surgery, what I do with these growths is they have a red growth on the eye, which basically the pterygium, or a small growth called the pinguecula, which I remove right up to the roots. In her case, we found 2 roots. I remove it and I put a human placenta, which is glistening without any stitches, no pain, no injection, no needles, no stitches. And they do very well. And even though this can't be guaranteed, I always have all my patients over the last 2 decades, now 3 decades, coming up to the mirror next day after surgery to exclaim how their eyes look, and they all call it sparkling white.
Yes.
And that's how it still stayed 21 years later. And also the function, improve the vision, make the eye more comfortable, treat the dryness with it. So this technique of doing no-stitch human placenta, the amniotic surgery that I do, is now called the sparkle technique. That's how it's trademarked. Sparkle is an acronym for sutureless pterygium amniotic reconstruction lamellar keratectomy. That's the concept I do this entire surgery with. And I expect, and I've been teaching eye surgeons all over the world for nearly 3 decades now, even in our textbook and courses at the academies, to encourage them to do this technique because it's the least interventional, very elegant, makes the patient look cosmetically good, the function improves, the comfort improves, and the vision also improves. I can't ask for anything more. And over 3 decades, it has stood the test of time. Even if you had a bad pterygium surgery somewhere or bad pinguecula surgery, this technique can still be used to correct that surgeon's surgery. You can also use a special vision corrective surgery, not LASIK. I don't like LASIK in these cases because it causes dryness and puts pressure on the area of surgery. LaZrPlastique is a surgery I have designed over decades of proprietary technique where without cutting or using any blades, I shape your cornea to perfect vision. I did that for your daughter.
Yes.
LaZrPlastique technique for high astigmatism, and people with pterygium pinguecula with vision glasses or contacts can be helped, right? Because I don't want you to wear contacts after you've done the surgery in that beautiful area. And dryness, which is an inherent part of this condition, pterygium and pinguecula, should also be corrected with the m.o.i.s.t therapy that I've designed, which actually corrects all the 3 layers of the tears, gives you back your comfort. So the dryness, the vision correction, and the growth pterygium or pinguecula surgery are all actually tied together as a triad. All 3 need to be corrected properly. And I repeat, even if you had complications of pterygium pinguecula surgery somewhere else, you can be fixed. If you had pterygium pinguecula surgery the way I do it, you can still be a candidate for excellent premium cataract surgery with multifocal lenses. So a candidate for laser vision surgery, not LASIK, LaZrPlastique, a candidate to correct your reading vision. All that can be done. So do not despair if you have red eyes, yellowish looking, tired looking eyes. You can be helped with this rejuvenation technique, and it's been an honor for me to have my patients trust over the last 3 decades and to keep on sharing with doctors impromptu like we are doing right now on a busy day in my institute. And I cannot say thank you enough, Ingrid, for all your trust.
And I brought someone to you. I didn't even know we were going to do this.
Yes. Another patient she keeps bringing.
Now live in Iowa, and I brought someone from Chicago to see this fantastic surgeon.
Again, an honor, guys, and please don't despair. Go to our website, gulanivision.com. It's built like an encyclopedia for you to have more and more knowledge. Call us, email us with any questions. So if you have pterygium, pinguecula, dry eyes, yellowish, tired looking eyes, any such thing, you can be helped.